So in this video, we're going to talk about your upcoming appointment with me, and we're going to talk about your x-rays, we'll talk about your labs, and determine what medications are necessary to help you recover post-operatively. So I want you to bring your book, and then on the inside of the book, you and I are going to create a plan specific to you, specific to your medications, your medical history, and so forth, that will help you post-operatively. So make sure you bring your book to this appointment. We're going to talk about several different medications. One is, as many of you already know, hip replacement has the potential risk for blood clot. So we want to do things to help reduce that risk. So of course you saw my simple exercise video for hips. Just walk once an hour, 5, 10, maybe 15 feet. That's all you need to do. And then do at least 10 ankle pumps. Those two things help reduce blood clot risk. So we want to make sure you follow through my book and check off each hour that you got that done. Additionally, though, we discuss the need for medication to help prevent blood clot. So in general, if you don't have a what we call a contraindication, a reason not to have to use it, we like to use baby aspirin, and we use that 81 milligrams twice a day. We do that for 30 days. If for some reason there's a reason you can't use baby aspirin, maybe kidney issues or so forth, then we will use a different medication, things like Xarelto or Eliquis, Lovenox, things like that. So we will make a choice as to what medicine makes the most sense for you. In terms of pain, there are a number of medicines that we like to use. One is Tylenol, acetaminophen. We use that round the clock. We use it 3 times a day, so it's not the maximum that you could take. It's 75% of the maximum, and that helps prevent side effects and irritating your liver. We like to use some oral prednisone for many patients, not everyone, but for many patients. It's a small amount of prednisone. It won't make your cheeks blow up, it won't make you gain weight, but it can help with swelling and help with the discomfort after surgery. Additionally, we frequently use what's called a non-steroidal, and Nsaid is the term we use, things that are similar to ibuprofen, which is also called Advil or naproxen. People have heard of that. The problem with those medicines is that they create extra bleeding, and so we generally use things like Celebrex, and if not Celebrex, we use meloxicam, also known as Mobic. Those are generic medicines, and in general, the majority of my patients use those 4 pills. 40% of my patients, that's all they need after hip replacement. However, 60% need something more, so what are we going to use? There are 2 more options. One is a non-narcotic option. It's called Gabapentin. Gabapentin is a pill that we use for burning and for sleep and for pain. So we use Gabapentin. It's a generic drug. We've used it for many years for diabetic neuropathy, burning in the feet. We use it for sciatic pain, burning electrical jolts down the leg. And we can use it after surgery. So we use that pill as needed. It can make you sleepy, can make you a little forgetful. So, be aware of that. You can try it, though, if the other medicines didn't work. So again, we will discuss whether or not that's an appropriate choice for you. It does depend somewhat on your age and your kidney function. So it's one of the pills we're going to talk about. Then, if that doesn't work, we consider our narcotic. As you know, narcotics have risk. So using a narcotic around the clock, every 4 hours for 24 hours has a 6% risk of permanent addiction. And so I generally try to have patients use these other medications first, use ice, and then if we need a narcotic, then I'm still going to provide you with something. So there's 2 choices we typically use. One is called Tramadol. That's the most mild. And if you're over 70, that's typically what we use. And then if you're under 70, or if you've used narcotics in the past and your liver now needs something stronger, then we will consider oxycodone. We've published a study that 97% of my patients use 10 pills or less. That's the lowest in the nation. So we start with that 10 pill number. 40% use none, and the average patient uses 3.5 pills, so not much. Less than a root canal these days. So I'm still pleased that my patients are doing well enough that that's what they need. And so those are the medications we generally consider. A couple other quick things about hip replacement that we want to talk about at this visit would be Many patients can get lightheaded, so I want you to use a walker for 2 days no matter what. No heavy lifting that first 6 weeks after hip replacement. I want the bone to grow into that implant. And then also something that's unusual, but it does happen with hip replacements. Frequently when the hip wears out, the lower spine wears out at the same time. So many patients, they can be doing great for 2 or 3 or 4 weeks, and then suddenly they'll call me and say, Dr. Wickline, I need to come in. I can't put any weight on my leg. Something's going on. So we have you come in. In general, almost 99% of the time, there's nothing wrong with the hip at all. It's actually the lower spine acting up. So again, when I fix the hip, after 3 or 4 weeks, the pelvis can kind of tip back into its more normal position, which sometimes, unfortunately, irritates the nerves of the lower spine, and that can last for a month or two if those patients get that problem. So I just want you to be aware of it. It's written in my book, but I like to talk about that. So if it happens, yeah, it's a little setback, but you're not anxious and extremely worried. That's half the battle in this job, is to help control anxiety and let you know what normal is. So again, if that happens, you'll let us know. And that's one of the other things we generally talk about at the pre-op visit.